Melamed community, what's up? We're back to another episode of Don't Let the White Coat Fool You. I'm Dr. Norma Mobley here with my dear friend,
Dr. Dixon, and listen, we want you to hit that thumbs up. We are ready to go.
Like and subscribe. And what are we going to be going to today?
I think today we'll talk a little bit about mental health awareness or beyond awareness.
Okay.
We talk a lot about education, but what do we do now? What's the action?
So now that we have become aware that mental illness is a thing and mental health is important, what's next? Basically, right?
Right. It's really trying to make sure that communities have access to care and that we approach it in a way that really works. So community-based mental health is really important, especially in communities of color or underserved communities. Meaning that we have somewhere for them to go where they can get almost wraparound services, right? Everything's there in one place.
Okay.
Something interesting for us to think about as physicians, having a pipeline to mental health out of our offices, or that we know where are the resources in the community that we can refer our patients to.
I think what would be ideal is if you actually had access to a mental health provider in your medical home, but that's not always possible.
It's not, but thank goodness there's some people out there that are really thinking that we can do virtual options for folks, that folks can access some of these providers without their insurance. And some are making sure that they have like a way for you to use a modified program so that it doesn't cost so much. That seems to be the barrier.
Cost.
It's cost. And if your insurance or you don't have insurance, then you can't get to it. So there are those who are out there that are really vested in healthy communities who will allow you to come either at zero cost or low cost.
Now, you just said something that I hadn't really thought about before, but it really is an issue that insurance providers are not readily covering mental health services.
Right, and it's something that we have to still concentrate on. You know, again, I know we're always pointing you back to your congressman and your senator, but it's why we vote, right? It's why we encourage you to think about who's in your local community who can help with these issues.
That's right.
That's where it all happens.
At the state level, it's important.
Right,
Yeah.
absolutely. And then, just as providers, if there are providers out there, making mental health a part of what we do is important as well. So we need to be able to recognize when folks are having issues or ask the question so that we can help by finding them resources or helping to prescribe medications, finding telehealth.
Right.
There are all kinds of options out there that can be really supportive to our families.
So like in the primary care setting, the urgent care setting, and of course the emergency room, being able to pick up on those cues.
Right. And especially when someone's in trouble right then. We're seeing so many caught up in taking medications that they didn't plan to, or, may have planned to take them, but we're seeing so many who are being impacted by one poor choice. And if we can help them figure out how to address their issues earlier, then maybe that poor choice doesn't happen.
Right. Now, we've talked about awareness and we've talked about access. What about treatment?
Treatment is the key. And we have to be willing to do that and let our patients know that treatment is okay.
It's okay.
But it's important for folks to know that the medication could be for short term, it might be long term.
Right.
And it just depends on your situation and what your needs are. And you want to fulfill that because you don't want to take the risk that you're going to have a poor outcome because you just decided you were too nervous about medication or you were embarrassed about medication. We don't want those to be the reasons why you don't take it. And we certainly don't want lack of funds to be the reason.
So the mindset about actually taking the medication can also be a barrier.
Oh, absolutely.
Right.
And which is why you have to get a provider that you trust in, a provider who knows about options for you, who is not going to stand in judgment.
And not just give you a prescription and not explain to you how the medication works. It's so important to know that many of the medications that are prescribed to treat anxiety or depression, it takes a while for it to build up in your system to actually start feeling the clinical effectiveness. It's not like, oh, I have a headache, let me take something. 20, 30 minutes later, I start feeling better.
Yeah, so you're looking at least a couple of weeks before medication is
at least, at minimum.
Right.
Some people may even take more depending on their body chemistry.
And just know that it's a commitment to yourself. And your provider can help you with that. So when we look at where we are with so many issues, whether they be social, emotional, happening in the world right now, there's no wonder we all need a little bit of mental health support.
Correct.
Whether that's, what we do with our breathing on our own, whether we do some Tai Chi, or whether we see a therapist.
Correct.
All are important to all of us gaining a better control of our mental health state.
It's best not to ignore it. Remember, if you have a flat tire and you don't do anything to change it, the rim is going to get involved and you're going to need a whole replacement for the entire wheel.
Absolutely. So we want to be proactive. And I just I saw this somewhere and I wanted to make sure I said it, that beyond awareness means moving from conversation to commitment.
Wow.
From recognition to resources. And from concern to care. So
I love that.
Let's get active and take care of our mental health.